Pulmonary hypertension is a medical condition characterized by elevated blood pressure in the pulmonary arteries. When pressure is high within the pulmonary arteries, the right side of the heart must exert more effort to overcome it. This leads to structural and functional changes to the right ventricle, ultimately resulting in right-sided heart failure. To learn more about right-sided heart failure, click on the link on screen or in the description below. There are several diseases and disorders that can cause pulmonary hypertension, the most common being a disruption in the homeostasis of vasoactive hormones within the pulmonary circulation. The hormones nitric oxide and prostacyclin have vasodilating effects, while endothelin acts as a vasoconstrictor. Homeostasis of these hormones is disrupted so that vasoconstriction of the pulmonary arteries is favored. The primary reason for this is most often idiopathic, meaning it has no known cause. However, it can also be caused by a BMPR2 gene mutation, connective tissue disorders like scleroderma, HIV, and portal hypertension. Left-sided heart failure or valve disease can also lead to pulmonary hypertension, as blood cannot move forward effectively, causing congestion in the pulmonary arteries. Chronic or extensive pulmonary emboli can also cause pulmonary hypertension by blocking blood vessels, causing increased resistance. Tumors in the thoracic cavity, such as those resulting from sarcoidosis, can also cause pulmonary hypertension by compressing pulmonary arteries. And finally, pulmonary diseases or disorders, such as chronic obstructive pulmonary disease and obstructive sleep apnea, can also cause pulmonary hypertension, as blood vessels vasoconstrict to shunt blood away from poorly ventilated lung tissue. When pulmonary hypertension is caused by a pulmonary disease or disorder and subsequently causes right-sided heart failure, this form of heart failure is referred to as cor pulmonale. If you want to learn more about cor pulmonale, you can click the link provided on screen or in the description below. The first and most common symptom of pulmonary hypertension is shortness of breath on exertion. Other typical symptoms include fainting, lightheadedness, and chest discomfort or pain. These symptoms arise due to a reduction in the amount of oxygen-rich blood reaching the left side of the heart, and thus systemic circulation in various tissues, leading to an oxygen requirement mismatch. As the illness advances, signs and symptoms of right-sided heart failure generally develop. Diagnosing pulmonary hypertension requires a high level of suspicion, and several tests are necessary for diagnosis and identifying the root cause. This includes a thorough medical history and examination. An echocardiogram can be completed to evaluate the function and structure of the heart. A ventilation perfusion or CTPE scan can be completed to rule out the presence of pulmonary emboli. A CT scan can also identify tumors and assess the pulmonary arteries for dilation. A sleep study can be completed to rule out sleep apnea, and pulmonary function tests can assess for lung disease. An ECG can reveal right-sided heart strain or a right bundle branch block. Various lab tests can also be completed, such as liver function tests to assess for liver involvement, as well as specific labs to test for HIV, lupus, and scleroderma. Right heart catheterization can also be performed, which involves a catheter being inserted into the pulmonary arteries to measure pulmonary artery pressure. The treatment of pulmonary hypertension involves treating the root cause, whether it be left-sided heart failure or a pulmonary embolus. However, when the cause is idiopathic, calcium channel blockers like nifedipine can be used. They help by causing vasodilation of the pulmonary arteries. However, calcium channel blockers are not effective for everyone. In such cases, alternative medication, including prostacyclins, endothelin receptor antagonists, or phosphodiesterase inhibitors can be used to cause vasodilation of the pulmonary arteries. If you want to learn more about these medications, you can click on the link on screen or in the description below. In cases where all treatment options have been exhausted, a heart-lung transplant may be considered as a final resort. Preventing pulmonary hypertension is dependent on its underlying cause, making prevention measures specific to each case. In some cases, prevention is not possible, but following recommended treatments can help delay or slow the progression of the disease. This wraps up everything you need to know as a nurse about pulmonary hypertension. I hope you found this video useful, and if you did, please show your support by giving this video a thumbs up, subscribing, and turning on the notification bell to stay up to date. Also, feel free to drop a comment below if you have any video suggestions. Thank you, and bye!